Welcome everyone. Today I'll highlight one of the organizational approaches on security breach cases and the relation between organizations, data protection authority, and individuals in the matter of reporting a data breach. Because we need to understand GDPR in a pragmatic way, I'll present one of the possible scenarios that underline the need of cybersecurity in a medical or health organization in relation with employees. In this scenario, we have the county hospital as a potential attack vector. We know that they are working around 1,000 employees. The county hospital's management, based on Article 37 to 39 from GDPR, designated a couple of days ago who should be the data protection officer. This health institution is one of the most important medical facilities in the county. Because of the lack of investment in the IT&C area, the organization has a single database where is stored all the data regarding the employees and patients for more than 75 years now. Today, the personal data of the employees and patients of the county hospital has been unauthorized disclosed on one of the most important social media platforms. The data that was leaked included as follows: the main identification data as the first name, the last name, personal numeric code, personal addresses, portrait pictures that were used in creating the ID badges, car identification plate numbers, family composition, monthly salary, and medical claim of each employee. There is no clue regarding the way this data got leaked. In this case, the hospital must inform the National Supervisory Authority of the breach. Since personal data that included sensitive data, such as health data, the company has to notify the employees as well. Based on Article 33, the county hospital must notify the supervisory authority regarding the personal data breach. As we all know, in the case of a personal data breach, the controller shall, without undue delay and where is feasible, not later than 72 hours after having become aware of it, notify the personal data breach to the National Supervisory Authority competent in accordance with Article 55, unless the personal data breach is unlikely to result in a risk to the rights and freedoms of natural persons. Where the notification to the supervisory authority is not made within 72 hours, it shall be accompanied by reasons for the delay. In the same time, because of the personal sensitive data of the employee and patient got leaked, the county hospital, based on Article 34, must inform the data subjects regarding the personal data breach as soon as possible. The communication to the data subjects shall describe in clear and plain language the nature of the personal data breach and contain at least the information and measures reported to the National Data Protection Authority. Nevertheless, there is one exception though. The communication to the data subject described above shall not be required if the controller has been implemented appropriate technical and organizational measures, and those measures were applied to the personnel and affected by the personal data breach, in particular those that rendered the personal data unintelligible to any person who is not authorized to access it, such as encryption. At the same time, if the controller would involve disproportionate effort and if has taken subsequent measures which ensures that the high risk to the rights and freedoms of data subjects referred above is not longer likely to materialize. In such case, there shall instead be a public communication or similar measures whether the data subjects are informed in an equally effective manner. You sure saw this on many TV channels or heard on radio programs in all EU member state countries. National Data Protection Authority is communicating the most important cases regarding personal data breaches. In case you are a data protection officer, please be aware of the recommendations regarding the personal data breach reporting. In the end, I say to you, stay safe by enhancing your cybersecurity culture.